My name is Savannah Yelkin. I'm a clinical director in BCBA at our Fayetteville location with Already Autism Health.
Hi, I'm Madeline Vickery. I am a BCBA as well at CABS Autism and Behavior Specialist, and we will be presenting today on autism spectrum disorder. Over the last several decades, autism awareness has increased significantly, but many families still feel unprepared and unsupported after the diagnosis. For many parents, the journey begins with hearing the words, "Your child has autism." Almost immediately after, families are expected to navigate therapies, insurance, school systems, wait lists, and overwhelming amounts of information. Parents are often left asking one question: what do I do now? Today, we want to talk about not only autism itself, but the realities families face after the diagnosis, the impact on caregiver and wellness, and what meaningful support actually looks like. So, before we discuss the realities that families are navigating, we first want to establish a shared understanding of what autism actually is. Autism spectrum disorder, or ASD, is a neurodevelopmental disorder associated with differences in brain development that impacts communication, social interaction, behavior, emotional regulation, and sensory processing. Core diagnostic features of autism include social communication deficits and restricted or repetitive patterns of behavior, interest, routines, or behavioral flexibility. Social communication differences may include difficulty interpreting social cues, challenges with reciprocal conversation, differences in nonverbal communication, delays in expressive or receptive language, or reduced social initiation and overall engagement. Restricted or repetitive behaviors may include rigid thinking patterns, strong preference for predictability and routines, repetitive movements, or language, highly focused interest, and even difficulty tolerating changes within their immediate environment. Many autistic individuals may also experience sensory processing difficulties or differences, including heightened sensitivity to sound, textures, light, smells, or other environmental stimuli. Additional features commonly associated with autism can include emotional and behavioral dysregulation, adaptive functioning deficits, sleep disturbances, feeding challenges, gastrointestinal concerns, and delays in developmental or motor milestones. ASD is considered a spectrum disorder because presentation, symptom severity, strengths, learning profiles, adaptive functioning, and support needs can vary significantly across all individuals. Some individuals may require minimal support in certain areas of functioning, while others may require substantial or ongoing support across multiple environments. Autism presentation can also differ significantly across gender, culture, cognitive ability, and developmental level, which has contributed to an increased recognition and identification over time. Another question that people often ask is why autism diagnoses have increased over time. Current research suggests that an increased autism prevalence is largely associated with improved screening practices, broader diagnostic criteria, increased public and professional awareness, and earlier identification. Diagnostic practices have also improved across populations that were historically underidentified, including females, minority populations, and individuals with more subtle social or behavioral presentations. Many individuals who have met diagnostic criteria years ago are now being more accurately identified and connected to services and support. In Georgia, current prevalence estimates indicate that approximately 1 in 31 children are diagnosed with autism spectrum disorder. This data reinforce that autism is not rare. It is a condition, and that healthcare systems, education systems, and community resources are increasingly impacted by the need for accessible and coordinated autism services. Here, you have a parent who just received a diagnosis and left the physician's office feeling relieved that she may finally have answers. But very quickly, that relief can turn into confusion, uncertainty, and overwhelm. Almost immediately, she's faced with outside opinions, misinformation, stigma, and pressure about what she should or shouldn't do next. Parents are often left hearing over and over, he'll grow out of it. Maybe it's a misdiagnosis, or he just needs more discipline. She looks fine, it's not autism. At the same time, they're hearing these things. They're trying to emotionally process what this diagnosis means for their family, their child, and their future. And while the system may provide a diagnosis, it doesn't always provide immediate guidance, support, or clear roadmap for what comes next. For many families, autism care begins during a period of uncertainty, and they often begin navigating these processes feeling alone and unsupported. And the reality is, this experience is far more common than people realize.
So, autism affects far more families than many people realize. Right now, approximately 1 in 31 children in Georgia are diagnosed with autism. And while every family's experience is different, many caregivers are navigating complex support systems, therapy, school concerns, evaluations, and daily stressors for the very first time. For many parents, this process can feel overwhelming and isolating. There's often a steep learning curve, long wait lists, financial strain, and uncertainty about what support their child and family truly need. And something we really want to emphasize throughout this presentation is that autism doesn't impact just one person. It affects entire family systems, routines, relationships, mental health, finances, and overall well being. As awareness and identification continue to increase, more families are entering these systems and trying to navigate them in real time. Something we really want to highlight is that autism doesn't only impact the individual child, it impacts the well being of the entire family systems, and very often, mothers become the primary coordinators of care.
Historically, autism was often described using terms like high functioning or low functioning. However, those terms are now considered overly broad and often inaccurate because they can oversimplify the complexity of an individual's strengths, challenges, and support needs. Two individuals with autism may have very different communication skills, abilities, adaptive skills, sensory needs, emotional regulation, or social functioning, making simplistic labels clinically limiting. Current diagnostic language instead focuses on levels of support needs rather than defining a person by their perceived functioning. Level 1 is categorized as requiring support. Individuals may experience noticeable challenges with social communication, flexibility, organization, emotional regulation, or transitions, but they may function more independently across many environments. Level 2 is categorized as requiring substantial support. Individuals often demonstrate more significant communication, adaptive, behavioral, or social support needs that require more consistent intervention and caregiver involvement. And level 3 is categorized as requiring very substantial support. Individuals may require daily support related to communication, adaptive functioning, safety, emotional regulation, and overall independence across multiple environments. It is also important that we recognize that support needs can vary significantly across settings, developmental stages, and areas of functioning. Because support needs can vary significantly across individuals, intervention recommendations and treatment intensity must also be individualized.
I want to introduce two mock families to show how different autism can look from one child to another. Family 1 has a 9-year-old child who's verbally fluent and described at school as intelligent, polite, and capable. But at home, the family's seeing meltdowns, rigidity, anxiety, social exhaustion, and emotional shutdowns. Because the child may not look autistic to others, the family may struggle to qualify for support, many of their concerns minimized, or may even be accused of bad parenting. Family 2 has a 7-year-old child with higher support needs. Their day requires a lot more planning around communication, emotional regulation, transitions, safety, and potentially harmful behaviors like aggression, self injury, elopement, or property destruction. Their family may be managing constant supervision, disrupted sleep, avoiding certain outings altogether, and difficulty arranging appropriate childcare. The point is that not one family has it harder than the other. The point is that autism creates different challenges for different families. Some needs are highly visible, and some are easier for others to miss. Both families need support, understanding, and practical resources.
Following a diagnosis, one of the primary evidence-based interventions families are often introduced to is applied behavior analysis, or ABA. ABA is considered the gold standard behavioral intervention for autism spectrum disorder and is grounded in scientifically derived principles of learning and behavior. The primary goal of ABA is to improve meaningful functional skills that increase independence, communication, adaptive functioning, emotional regulation, and the overall quality of life. Treatment may target areas such as communication, social interaction, play skills, self-care routines, behavioral flexibility, emotional regulation, readiness, and reduction of behaviors that interfere with learning or safety. ABA services are highly individualized and based on each child's strengths, deficits, developmental profile, and family priorities. Before treatment begins, a BCBA conducts a comprehensive assessment evaluating the communication abilities, adaptive functioning, behavioral presentation, environmental barriers, and the overall support needs of the individual. This assessment is separate from the diagnostic evaluation for autism and is used specifically to determine medically necessary treatment recommendations. Within the medical model, treatment intensity and recommended service hours are based on functional impairment, behavior complexity, adaptive deficits, and the level of support required across all environments. Treatment plans are continuously monitored, modified, and they use ongoing data collection, progress monitoring, caregiver collaboration, and clinical decision making. ABA also heavily relies on caregiver involvement. Parent training, consistency across all environments, and the collaboration between caregivers and practitioner are essential components for a successful treatment outcome. In many ways, caregivers become active participants within the treatment process because meaningful progress depends heavily on generalization and supports outside of the direct therapy session. It is also important to clarify that modern ABA is not intended to remove individuality or harmless self-stimulatory behaviors. The goal is to support functional independence, reduce barriers to participation, and improve the overall quality of life. One aspect of autism care that is often overlooked is the invisible cognitive and emotional load carried by caregivers. Behind every therapy appointment, school meeting, insurance authorization, behavior plan, daily routine is someone coordinating, planning, advocating, and consistently adapting. Caregivers are often managing multiple systems simultaneously while also balancing employment, household responsibilities, financial stressors, and the emotional demands of parenting. Many families describe feeling like they are constantly operating with a mental checklist running in the background, tracking schedules, preparing for transitions, communicating with providers, anticipating challenges, and monitoring progress. Research consistently demonstrates elevated levels of caregiver stress, anxiety, emotional exhaustion, and burnout among caregivers of autistic children. The burden is often intensified by long wait lists, fragmented systems of care, insurance barriers, and delays in access to services. And while these responsibilities affect the entire family, women, particularly mothers, frequently become the primary care coordinators and advocates navigating these systems. The reality is, autism does not only impact the individual diagnosed, it impacts the entire family system. Caregiver well-being directly influences family functioning, treatment consistency, and long-term outcomes of children receiving support, which means the supporting caregivers is not separate for the autism care. It is an essential part.
And of course, as Madelyn mentioned, research consistently shows that caregivers of autistic children experience elevated stress and mental health burden compared to the general population. Many caregivers experience higher rates of anxiety and depression, chronic emotional and mental load, disrupted sleep, and ongoing fatigue. And for some families, the demand of caregiving can also lead to increased isolation and reduced participation in everyday activities, relationships, and community life. A lot of this burden is invisible, and importantly, caregiver stress doesn't only occur in families with highly visible support needs. Some families might be managing safety concerns or severe behavioral challenges, while others are supporting children who appear very independent externally but are struggling internally with anxiety, rigidity, sensory overwhelm, or emotional exhaustion. Research also shows that parenting stress levels in caregivers of autistic children are significantly higher than comparison groups. And this matters because caregiver well being directly impacts family stability, treatment consistency, and long term outcomes. When caregivers are overwhelmed or unsupported, the effects ripple throughout the entire family system. And another piece of this conversation is the impact of autism caregiving is not only emotional, it can also significantly affect long term career and financial stability. Many caregivers reduce work hours, change career paths, delay advancement opportunities, or leave the workforce entirely in order to manage appointments, therapies, school meeting, transportation, various crises, or daily caregiving responsibilities. And much of this labor is unpaid and largely invisible. It's scheduling, coordinating services, researching resources, advocating in school systems, managing routines, and constantly adapting to changing needs. Over time, these demands can create significant financial strain for families, especially when combined with the cost of therapies, childcare challenges, missed work, or limited support systems. And importantly, this impact is often cumulative. It's not just about one difficult moment, it's the long term effect of chronic caregiving demands over months and years. So, when we talk about supporting autistic individuals, we also have to think about supporting the sustainability and well being of the people caring for them.
When discussing autism intervention, one of the most important questions we should be asking is what actually helps families in a meaningful and sustainable way? Research consistently supports that early, individualized, and evidence based intervention can improve communication, adaptive functioning, emotional regulation, independence, and the overall quality of life. High quality ABA services focuses not only on skill acquisition, but on reducing barriers that interfere with meaningful participation across all settings. Effective intervention should be individualized, collaborative, and responsive to the specific strengths, needs, and goals for both the child and the family. Another critical component is caregiver education and support. Families benefit most when providers often offer realistic expectations, practical strategies, consistency across environments, and clear communication. Coordinating systems of care and accessible support systems can significantly reduce caregiver stress and improve long term outcomes. As we close here, we see the same mother we saw earlier in the presentation. At the beginning, she was overwhelmed by uncertainty, stigma, misinformation, and the pressure of navigating complex systems alone. She was hearing comments like maybe it's misdiagnosis. He just needs more discipline. She'll grow out of it. They're overdiagnosing autism now. But meaningful support changes outcomes, not only for the child, but for the entire family system. When we talk about autism, we often only focus on the diagnosis, the therapies, and the child's outcome. But behind every service appointment, behavior plan, and milestone is a career, is a caregiver carrying an enormous amount of responsibility. Autism does not only impact the individual diagnosed, it impacts the entire family system. And research continues to show that caregiver well being directly influences consistency of care, family functioning, and long term outcomes for children. If we want better outcomes for autistic individuals, we also have to support the people coordinating, advocating, and showing up for them every single day. This means improving access to care, reducing barriers within systems, providing meaningful caregiver education and support, and creating services that help families function rather than adding additional burden. Because supporting caregivers is not separate from autism care, it is an essential part of it.
And this is one of the biggest areas where providers can make a meaningful difference for families. Of course, therapy should support the child, but we also need to make sure we're supporting caregivers. Many families are already overwhelmed, exhausted, isolated, or carrying guilt and judgment from others. They need to feel seen, heard, and genuinely supported. We need to provide care that actually works in real life contexts, not just goals that look good in documentation, but strategies families can realistically implement in daily lives. We need to approach barriers with empathy instead of blame. If a caregiver is struggling with follow through, attendance, routines, or implementing recommendations, we should first ask what barriers are present here, rather than assuming they don't care. Flexibility matters. Families have different levels of capacity depending on stress, finances, work schedules, mental health, sleep, support systems, and the child's needs at that moment. Adapting when possible and meeting families where they're at can make services feel collaborative and sustainable. In the long term, one of the most important goals is helping caregivers build confidence and skills so that they can support their child's independence over time and reduce reliance on services when that is appropriate. Okay, and as we close, we wanted to include a few resources that may be helpful for clinicians, caregivers, educators, and anyone wanting to better understand autism, burnout, and neurodiversity affirming support. These books were selected because they combine evidence based information with compassionate, practical perspectives. Burnout explores chronic stress, emotional exhaustion, and the invisible labor many caregivers and professionals experience. Is This Autism is an especially valuable resource for understanding the wide range of autistic presentations, including individuals who may be missed or misunderstood. Uniquely Human and The Explosive Child both encourage us to move beyond seeing behavior as simply noncompliance and instead understanding the underlying needs, stressors, and communication behind behavior. And The Happiness Trap introduces concepts from acceptance and commitment therapy, which focuses on psychological flexibility, values, and sustainable coping strategies. Ideas that are relevant not only for autistic individuals, but for caregivers and professionals as well. We really believe that supporting autistic individuals starts with building systems that are informed, compassionate, flexible, and sustainable for the entire family.
Thank you for allowing us to highlight not only autism, but also the experiences of families navigating it. And thank you for recognizing the importance of supporting the entire family system and not just the diagnosis itself. We hope this conversation encourages continued advocacy for more accessible, compassionate, and meaningful support for all families. Thank you.